Welcome back. We're going to continue our discussion with Dr. Louis Sullivan, who's President Emeritus of Morehouse School of Medicine and former Secretary of Health and Human Services. And actually, I could go on and on. There are a lot more accolades there. But Ed, as we were finishing the last segment, you were talking about how you met President Bush and the opening of the Morehouse School of Medicine and how that led to being HHS Secretary.
Yes, that really was a series of things that happened. I accepted the Vice President's invitation to accompany him to Africa in November of '82 in visiting 8 countries. And while he was meeting with heads of state, his wife Barbara was on that trip. She was meeting with adult literacy groups, usually adult women in various African countries who were learning to read and write. She was very committed to that. And on the way back from those 2 weeks of visiting those 8 countries, I spoke with Barbara. I said, you and I are in the same business, education. You're in adult literacy education. I'm in medical education. We have this new medical school that's underway. I told her what we were trying to do. I said, you need to be on our board. She accepted that invitation. So for 6 years, from 1983 to 1989, she served on our board. And I got to know not only her, but then Vice President Bush very well. I learned about his commitment to education as well, and I began lobbying him during his campaign for the presidency in 1988. I began lobbying him for one of my trustees who had been a finalist in a previous competition for that position, but did not get the appointment. I thought he would be a great secretary. But after the election in November of '88, when I called to congratulate President-elect Bush, I said, now remember we had this conversation about Monroe, who would be a great secretary.
Right.
I hope you'll consider him. He said, Lou, well, if you'd be willing to come up in a couple of weeks, I want to talk with you about this. I was surprised. I didn't know what that meant, but that's what led to it.
That's amazing how all these things they do happen. And speaking of your board, you've had a recent friend who passed away and has been influential in the Morehouse School of Medicine and all. Now, in fact, Vicki was just mentioning that to me as well.
Dr. Maya Angelou. I loved her, such an inspiration, and it was so sad. And I was reading an article about you and how she really meant a lot to you when she was at Morehouse.
Oh, yes. We were fortunate that she, in the early 1980s, served on our board for 3 years. I was introduced to her by Bob Brown, an African-American friend of hers in North Carolina, and prominent in black Republican circles. We approached her. She accepted the invitation to serve on our board. She really brought a tremendous presence. Her articulation and understanding of the English language, her strong feelings about a variety of issues, human rights, women's rights, etc., her commitment to young people, all of these she brought with her as she served on our board. So she really made a tremendous contribution to our development. We have a strong program called Humanities in Medicine that she and others helped influence, training doctors not only the science of medicine, but the human aspect of medicine as well. So we really miss Maya Angelou. She contributed a lot, not only to Morehouse School of Medicine, but to Americans all over. So she was a great person.
Well, you've been traveling all around the country promoting your book, Breaking Ground, My Life in Medicine. How's it been received out there in all these cities?
Well, I have been pleasantly surprised how great the level of interest is in the book, because I've had book signings in Denver, in Detroit, in Boston on 2 occasions, in Washington, D.C., at the museum there, as well as a number of signings here in Atlanta. And I have signings scheduled for Tampa and Houston and even Martha's Vineyard this year. So it's been great, and I've been quite surprised that the level of interest
That's
is
great. Well, I just think there's a wealth of knowledge that you have, and you could probably have written, and probably can write 3 more books to continue this one. You were groundbreaking way back when. Walking. Who would have thought? I mean, you were a leader in saying we need to get out of the chair and start walking, and this was decades ago.
Oh, yes. My wife and I, around 1970, began walking primarily for weight control. And we, first of all, found that we enjoyed doing this. We found that early in the morning was the best time for us to do it. Not only was this good for weight control, but for our health in general. We felt a lot better after we walked. My level of energy throughout the day was greater. And we now know from a number of public health studies that walking has definite health benefits. It not only helps with weight control, but it also helps reduce the incidence of hypertension or diabetes. It helps prevent obesity. There's even some early evidence suggesting that it may help delay the onset of Alzheimer's disease. It keeps the bones and muscles strong. So it really is one of those things that we promote that people should do, because over the last 30 years or so, I've walked in really virtually every major city in the United States and some 30-odd countries around the world.
Wow.
And I enjoy it, and my wife does also.
Once again, we're talking to Dr. Louis Sullivan, former HHS secretary and is now president emeritus of Morehouse School of Medicine. Through your experience as HHS secretary, you had been working on medical issues, reform of medicine, before President Obama. You'd worked with President Bush, and a lot of the ideas that you all had promoted wound up in the Affordable Care Act. So tell our listeners a little bit about what you did in the Bush administration and how similar some things are to the Affordable Care Act.
Oh, yes. Yes, we had, first of all, a great staff there at the Department of Health and Human Services, and a number of things that we did. First of all, we promoted the concept of prevention and of such things as heart disease, cancer, stroke, diabetes, etc., by a number of preventive things. Vaccination for children here. We released in September of 1990 a report to the nation called Healthy People 2000. 298 specific objectives we felt we should try and reach by the year 2000 to keep people healthy. The bill that we developed included such things as group purchasing arrangements for small businesses and individuals, similar to the networks that are in the Obama.
So the ability to buy health insurance in exchange
Yes,
of sorts.
Exactly. Insurance incentives to assist those individuals who need help because of lack of resources. The other things were to really improve the health literacy of our population, because we know that people who have less years of education don't use the health system as much. We tried to shift the emphasis from a system primarily focusing on sick care to really shifting for wellness maintenance. People need to really think of ways to prevent illness and injury as an important way to address our health needs.
And you've been doing that, again, starting with walking in your foundation. Tell us a little bit about your foundation.
Oh, yes, right. We have what's called the Sullivan Alliance, which is an organization based in Washington, D.C., that's working in 9 states now.
Wow.
That's focusing on improving health behavior and increasing the diversity, racial and ethnic diversity among our nation's health professionals, helping young people plan for careers in the health professions, because we still need more, not only doctors, but dentists, nurses, pharmacists, and
we're going to
others.
need more. We're trying to wonder what the motivation is now for going to medical school. And there are a lot of young people that are concerned, should I spend all this money getting this medical education and then I'm not going to be able to repay the loans or sustain? I think there's a lot of fear out there that's unjustified, but this is important. We really have got to promote medical education. Otherwise, there's not going to be anybody there to take care of us.
Oh, absolutely. There are 32 million people who will be brought into the health system who are not well served as a result of the enactment of the Affordable Care Act. So we need to have personnel for those 32 million more people. We estimate that we need 1 million more nurses, 120 to 130,000 more physicians, about 150,000 more pharmacists and public health workers. That's an investment not only in those young people, but that's an investment in our nation's future if we are to address the needs. And this will, in the long run, save dollars, because by keeping people healthy, we will avoid those expenditures in the health system.
Absolutely. When we come back, we're going to talk more about the Affordable Care Act, and in particular, America's dental health crisis. Stay tuned. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.